Thank you for joining the Constitutional Medicine Part 4, Allergy and Immune Health, which includes the Dyscratic Constitution with Henrietta De Jong and myself, Heather Schofield. Henrietta, I'm super excited to introduce you to her. She has over 25 years of experience and is a specialist in European biological medicine. Beyond SANM and psychosomatic energetics and drainage and detox, that also means she's an expert in homotoxicology, iridology, and constitutional medicine, which really does make her the perfect person to be introducing and presenting this webinar tonight. So with that said, I'd like to turn it over to Henrietta, and we'll get our presentation started.
Thank you, Heather. It has been an absolute pleasure doing all these webinars and these series with you. I'm sure by now all of you know Heather. She is the Medical Education Director of Biomed. She's extremely knowledgeable and she's very supportive of her clients. I would say all of the staff behind the scenes there of Biomed, they are very well educated, they're great people. They provide excellent customer service. They have a very good quality control division. Their president, Gavin Ma, is an ethical businessman. He's honest. He's also very trustworthy to his customers and also to his staff.
As always, Henrietta, thank you for your lovely introduction of Biomed. So as we get started, can you talk about constitutional medicine and give an overview for any of those people who haven't had a chance to jump onto any of our constitutional medicine webinars yet?
Absolutely, Heather. When we talk about an individual's constitution, it determines typical disease pattern and expression and how the disease will develop in the body. So when we can often actually notice the eye color and the structure changing during the first year in the baby's eyes. And I have noticed that they will keep changing for the first 7 years. And by that time, the pattern will set. That's why I often say to the parents that it is so important that this child is nurtured very well during those first 7 years, because it has a huge influence on how that genetic pattern is actually going to set. So basically, it's the individual's DNA then that's passed forward through our generations. When you look at the eyes, you see a unique representation as a reflection and structure of how that genetic pattern is going to look like. So a stable and happy environment, again, is very, very important. And it also includes the person's adaptability to his or her environment. So then when we go a little bit further, the Constitution is the sum of the inborn characteristics, and we go then to the type of influences that take place, such as when we talk about the psychological stress. It is very important that we realize that the stress in our lives has a huge influence on the weak spots. So when you think about broken relationships, when you think about stress in the workplace, family stresses, these all have a very big influence on how the disease might develop. Then the second one is our nutrition. We are what we eat, famous words, but very true. We need to have appropriate diets because that also is very important for the immune system. We need exercise. We need to have regular rest patterns. Sleep is important. We need to have relaxation time. That weather, climate, pollution, any of this can influence our genetic patterns. And those of us that are very unfortunate, that are born with miasms, those genetic patterns are then already set at birth. Now, when we think about other things, we think about our patients that are on multiple medications. They are very hard, again, on the body, the side effects. We can also think about people with drug use and alcohol abuse. that has influences. So all in all, it is then the patient that has to be capable to react to all these environmental influences, and that depends how they can do that by their genetic patterns. Okay, so it is easy to determine what color our eyes are. We only have to look at them. We don't need any fancy equipment for that. They're either going to be blue, they're going to be brown, or they're going to be mixed. Now, the mixed eye color can be all kinds of different kind of mixtures. It can be gray, blue, it can be green. So you'll see all kinds of mixed colors in that case. In general, when you first start putting the patients on the drops, they will tell you that they just feel better. They cannot quite describe why, but in general, they feel better. So it then keeps the health on track. And we want to break the disease patterns, of course, according to the genetic weaknesses. We want to strengthen that weak genetic part. We want to try and predict how those patterns of weakness are going to develop and prevent them from developing further. And then we want to resolve symptoms according to their constitution. We want to see where they're at. And so we have to learn how they are walking the path of their genetics. And a great tool to use for that is homotoxicology, of course, because that is teaching us how that patient is walking the path of their genetics.
So Henrietta, with homotoxicology, can you talk about it in reference to constitutional medicine?
Absolutely. Homotoxicology is a therapeutic approach which enables the deep cellular cleansing of our body's tissues, cells, and of course the three very important points or pillars of homotoxicology is drainage and detoxification, therefore immune modulation and cellular activation and organ strengthening. If we can't get rid of a toxin, the body will not heal.
And so with homotoxicology, there's 6 phases or 6 ways that things increasingly develop within the body and or can be reversed. So can you talk about this kind of in general, and then we'll go into talking about it specifically with the dyscratic symptoms?
Yes, of course. The first phase is called excretion phase. You will have, some vague symptoms that don't really connect to any disease patterns, but they're just vague symptoms. So the body in this case is trying to get rid of the toxins. So it's either going to be sweat or sneeze. It has runny noses. Digestive symptoms can be vomiting or diarrhea. And then it evolves to the second phase where inflammation is going to happen. That's why we call it the inflammation phase. So the toxins in the body are harder to get rid of in this case. So the body starts to produce those fevers. And those fevers are a protective mechanism because it's really trying to promote to heal itself that way. And we like to suppress those fevers, but they are useful for the healing process. That brings us then to the deposition phase, that's number 3. And in this phase, the toxins are already starting to be stored in the connective tissue, which means in the circulation, the vascular, and the adipose tissue. And in this phase, it's kind of a dangerous sign there because it has no symptoms. So we can be fooled into thinking that nothing is happening. In the meantime, things are developing to the further phase, and that is number 4, called the impregnation phase. The toxins then move into the cells, and this is where you'll see the early stage of the disease symptoms taking place. Then if things go down further, we are in the degeneration phase, which is number 5, and the toxins will damage the cellular defense mechanisms, the enzyme functions, and the energy production, and severe illness is starting to set in. And then the last phase is, of course, total disease, the dedifferentiation phase. The toxins are actually causing genetic damage, and in this phase, we can often see the cancers.
And so now moving on in reference to homotoxicology, can you talk about what types of symptoms you would see in respect to the Dyscratic Constitution?
Of course, so the first phase, let me say this, the phases 1, 2, and 3 are much easier to influence when just supported by the constitutional remedy. So if they are in the first 3 phases and they are on the Thuya, we will help halt that disease progression. So again, the excretion phase, we'll see them sneeze, we'll see them with a runny nose. The inflammation, we will see them with the frequent colds. It can be bacterial or viral, and fevers are produced. Then the deposition, that's the danger phase again, because there's no symptoms. So the junk is just being stored in this adipose and vascular tissue, as we said. Maybe your patient will get over the colds, but we know in the meantime, the diseases are progressing. And I'd like to, give a little bit of an example here. When my parents come in with the kids and they're young and they have severe allergy symptoms, and they tell me, well, he used to have this and got over it, and then nothing happened for a long time, but now he has it suddenly again, he or she. So you can see that for a while there was no symptoms, but then it comes back with revenge, and you're into the next phase, which will be the impregnation phase, and they will have the chemical sensitivities, the food and the environmental sensitivities. They're starting to develop in digestion. Their bowel habits will change. They'll come up with their skin rashes, their hay fevers. And then we move forward to the degenerations. The sensitivities now become severe allergies, and those will have anaphylactic reactions. And they will have no energy at all. You'll often see cysts that start to form, or those fatty lumps, you see them in this phase. And that's just a sign of storing toxins. And then the last phase is always the dedifferentiation, is the end states of the disease. And in the Dyscratic people, for instance, you'll find the neoplasms, you'll find diabetes, you'll find gout, you'll find rheumatoid arthritis, lupus, or any other autoimmune disease.
All right. That's a really nice way to be able to understand how disease progression happens within the body and what to be able to look for, and then also know that there is the ability to do some reversal and help reverse back through some of those stages as well. So now that you've started to talk about the Dyscratic Constitution in more detail, can you do some overview with the immune system, and then we can start moving into the more specifics on the Dyscratic Constitution?
Well, we all know the immune system is our most important defense mechanism, and it protects us from foreign invaders. And of course, in the Dyscratic Constitution, the immune system is the weak part. And so knowing this as practitioners, we should be prepared to treat that. So the signs of a weakened immune system then, as we move forward into the slides here, we get the general colds and flus, we get the chemical sensitivities. Lots of patients I see with their chronic sinusitis, which is often also connected to food sensitivities or environmental issues. Those are your patients that will come down with bronchitis once or twice every winter. Those are your patients that have generally frequent occurrent infections, lots of strep throat you'll find multiple times per year. Again, the immune system is weak, so they will have it not once, but many times. They will come out with their skin problems like the rosacea, the psoriasis, the itchy dermatitis. Again, the lymphatic system is overtaxed and will dump those toxins into the skin. So we will see that come out in these type of diseases, and we will see the growth, the warts, the skin tags, fatty lumps, cysts, and also tumorous processes.
Now, specifically, can you just do a nice review of the immune organs and the tissues?
Yes, in general, our immune system protects our body, of course, from the bacteria, the viruses, the fungus, the parasites, and other toxins. So our first line of defense here is the skin and the mucous membranes. The skin produces the oils and the protective immune cells. The mucous membranes secrete the mucosa, of course, in the respiratory, digestive, the urinary, and the reproductive systems, and the germs, they like to stick around there, and we like to move them out. Now, the lymph nodes, they have our lymphocytes, the white blood cells, they filter them and they destroy the germs, and they send the white blood cells into our circulation to find those invaders. The spleen is a very important organ. It stores the white blood cells, it filters the blood, and it destroys old and damaged red blood cells. The tonsils and adenoids located in the throat, the nasal passages, they trap the foreign invaders as they enter our body. The bone marrow produces those lymphocytes that we need so badly, and the stem cells develop into the red blood cells, the plasma cells, and the white cells are released by the bone marrow into the blood again. Thymus, in the middle of our chest, very important, produces cells. It's especially play a big role in the allergy responses, and it also destroys the infected cells and or cancerous cells. And then the other, the appendix plays an important role. The stellate cells in the liver play a role, and then not to forget in our gut, the Peyer's patches.
So thank you for that lovely review. So then to move on, as we're moving into now the specifics on the Dyscratic Constitution, can you talk a little bit about what that looks like as far as the goals for Dyscratic therapy?
Of course, our overtaxed immune system is a weak immune system. So we have to think about how do we strengthen that immune system, prevent those colds and flus. What can we do to strengthen the Peyer's patches? What can we do to combat autoimmune disease? And of course, we need to decrease the chronic inflammatory reactions, as in allergies, inflammations of the airway, and then, of course, our joints, because we'll find rheumatoid arthritis and osteoarthritis here. We need to get those good bacteria going in the gut, so we need to rebalance the dysbiosis. Then we need to decrease the toxic load in our tissues and in our skin, as in the warts, the ulcers, the cysts, other growths, the glands. We need to make sure they are not swollen, because we'll find them swollen and very hard and very enlarged as an immune response. And we need to increase circulation and oxygen carrying capacity to our cells and tissues.
So with that overview of the therapies, can I now get you to do an overview of the constitutions so that we can then get specifically into the Dyscratic Constitution?
We have the lymph type, the lymphatic type, which is the blue-eyed, also called the penicillium for our Sanum users, the penicillium type. We have the three subtypes addressing the liver, the kidneys, and the spleen there as well. And for these constitutions, we need the remedy lymphodrop. Then we move on to the hematogenic type, which is our brown-eyed people, and the mucor type. They have two subtypes there. There is the one with the brown ring around the pupil, as well as the pigmentation one. For those, we need taraxacum. And our Dyscratic type, which we are discussing today, is, of course, the aspergillus type, and we need Thuya. And then we have the three subtypes there, which we're going to be talking about shortly.
Okay, so now let's get into the specifics of the Dyscratic Constitution.
Okay, the Dyscratic Constitution, the eye color is gray, green, mixed gray, blue, brown eyes with the different pigments. They also come without pigments. So we can either have pigmented eyes or non-pigmented eyes. The complexion often is a fair skin with pigmented moles often. The physical structure, they have delicate bones and lean muscles, long arms and legs often. Possible disease that we can find is the colds, the intestinal dysbiosis, constipation, and yes, liver, gallstone, liver issues, gallstones, skin disorders, rashes, itchiness, cysts, fatty lump, osteoarthritis, gout is another one. Allergies, we can see the environmental and food and chemical sensitivities. We can find the autoimmune tendencies in there, as in rheumatoid arthritis, lupus, diabetes, especially type 1 in this case. And the weakness, of course, is the immune system and the metabolism in the skin. So the Dyscratic Constitution, as we said, can be seen as the Aspergillus or even the Tuberculini type for the SANM users. We can identify them also as ectomorph. They're naturally quite slim. They have a light build with small joints and lean muscles. And they have a very fast metabolism and burn up their calories very easy. Some of us will call them the kidney type, the adrenal, or the thyroid type.
So with that overview and the discussion with the Dyscratic Constitution, you've alluded that there's also subtypes that go with it. And so with the subtypes, if I understand, we've got subtype 1, subtype 2, and subtype 3, which you're now going to detail. So let's move on to the very first subtype, which is subtype number 1.
All right, here we have the brown, gray, green mix color with the brown ring around the pupil, which is actually in the iridology language called central heterochromia. So these people are always predisposed to digestive disorders. And so you'll see the gastritis, the dyspepsia, the dysbiosis, again, the constipation, but you also find the inflammatory bowel diseases here is in Crohn's and ulcerative colitis. We have IBS, spastic bowel, and we have the diverticulitis. Now, this type is a very common occurrence in my practice. And they often have very severe food sensitivities. They are often gluten intolerant. They definitely need to avoid milk. You'll find these people often crave sweets because they can have underlying candida and often underlying parasites. So again, the foundational remedy is thuja. And then in case of constipation, we can add Cardus. And for the Crohn's and colitis, the first 2 weeks of their treatment, I like to use the Ribosan to get the Peyer's patches going. Very important remedy in this case. For the general GI symptoms, we can use the GI formula that Biomed carries. They have very, very good formula for the digestive system. For stomach symptoms, I like to use the GastroEase, and then of course we need to focus because they often don't have their digestive enzymes. We definitely need to use Biozyme or Digestozyme. As probiotics, we can use the 7-in-1 or the Bacillus coagulans.
All right, that was a great overview, and I'm sure now everybody needs to look in their patient's eyes for this specific characteristic. Okay, so then how about subtype number 2?
Subtype number 2 is not as common, but still we see it quite a bit. It always deals with the skin, and the iris color will be bluish or gray, or a mixture of blue and gray, and you'll often see this yellowish or brown pigmentation in there. And so by that, we will know that these patients are predisposed to allergic skin diseases, and we'll find the eczemas, and we'll find the itchy dermatitis kind of things. And again, these patients are often predisposed to candida as well. And so we like to treat that again, first of all, thuja. For the lymphatic congestion, we like to add lymphodrop. We need to flush, and we can add Luvos for the skin topically. But I also like to use, we can use Pleopef or ELP if the skin is affected, infected, we can add Pliocin staph. And not to forget, we do need to support the liver as well. And in severe cases, we can do a complete body detox as a lymphodrop taraxacum and Solidago, or you can use lymphodrop A hepatica and Solidago.
All right. And then let's listen as you talk about subtype number 3.
Subtype number 3 is not as common, but we do see it. And that one deals especially with the liver and the nervous system. So we will see a very watery blue iris, and it's like a combination of the lymphatic and the hematogenic constitution. There is multiple dark pigments, but they're not the bigger ones, they're mostly smaller ones. So you'll know this patient will be predisposed to the liver disturbances, as in liver cirrhosis, fatty liver, liver enlargement. They will have the hepatorenal syndrome, they can't flush, they can't detox. And those patients, they have terrible neuralgia pains. And for that, I truly like to use Neurovita for that type of pain, because these patients are often weak patients. You'll find that the adrenal system is not very healthy at all. So if you use Neurovita, you can also add Adrenoplex or Adrenum, because they are in a lot of pain. And of course, for the liver support, we can add the taraxacum. And for the kidney support, we can add the Solidago or the Parsagas.
All right, those were good overviews. So now that you've talked about constitutional medicine and then dove really nicely into the Dyscratic Constitution with the 3 subtypes, can you start to talk about solutions for what we're able to do with our patients? And of course, the foundational remedy, Thuya. Can you describe that for us?
Yes, well, of course, the Thuya is used to strengthen our immune system, to reduce the inflammation, and then improve the blood circulation to the tissues. It is used in all chronic conditions with underlying weakened immune systems. Now, just as a side note here, we can use Thuya in any type of immune problems. The patient doesn't necessarily just have to be in the Dyscratic Constitution. We can use it for the lymphatic and the hematogenic constitution as well. Weakened immune system, Thuya, it always works. Now, the Thuya supports the immunity by improving that blood circulation, by relieving the symptoms from colds and influenzas, decreasing the inflammations, as in the allergic reactions, supporting therapy for autoimmune conditions, and reduce the side effects. That's a nice effect of the Thuya. The Thuya will work after your patients have been vaccinated. If they are known to have side effects, it will reduce those side effects. Now, the specific conditions for use, of course, the immune function again, the skin and the mucous membranes, the growth on the skin, the warts, the polyps. We will talk about that a little bit more in our protocols as well. And of course, for the respiratory, again, it reduces that inflammation and the allergic reactions. The digestion, it will help with the spasms in the biliary tree and in the digestive tract. Now, we recommend for adults and children over 10 years old. This is very general dosing, but it's a very potent remedy, so we need to take not as many drops as in other remedies. Take 5 to 10 drops 2 to 3 times daily. Children, the little tykes, 1 to 3 years old, we can do 1 to 2 drops 2 to 3 times daily. And 4 to 10 years old, 2 to 4 drops 2 to 3 times daily. Now, depending on the severity of the symptoms, I do dose higher if that is necessary.
Now, Henrietta, if you've got patients coming in with maybe more specific type of immune things, or you want to be looking for other options, can you describe some other options that might be helpful for practitioners?
Again, Biomed has a wonderful remedy line for the immune system. So typical when I have patients with severe bacterial infections, I like to choose BioBoost, especially strep infections. It's wonderful for that. You'll find that patient come in, they're kind of weak, they're exhausted, they have these fevers with headaches, and we use BioBoost, and that will stimulate that immune system, and it will increase the phagocytic function of the leukocytes, and the dose high the first day, acute, let them take those 40 drops in water until every 4 hours until those signs are disappearing. And then you can put them on a general dose of 20 drops 3 times a day. Basically, with the BioBoost as well as the Fluence, I let them take it a week. If we still have issues, then we might have to look a little further, possibly into an antibiotic, because then these infections are too severe to be treated this way. So the Fluence, as it says for influenza, influenzas are often caused by the viruses, and those viruses will have the chills, the aches, often cough. Again, these people are often restless, and this remedy will relieve and reduce the flu-like symptoms. Again, in acute, let them dose high and take 16 to 20 drops 8 to 10 times daily or hourly if necessary until those symptoms reduce. And then the general dose is 16, 20 drops 2 to 3 times daily, again, no longer than a week. Then we go to the mycoimmune here, which is a very beautiful immune booster. It's also an antiviral. It strengthens our immune system. It's an immunostimulant. I use it in all my cancer patients. There is not one that does not go on this because it has an anti-tumor reaction and it has antibiotic properties. So the dosage here is easy, 2 capsules twice a day, but take it with meals. Now, Immunoplex is, I use that prophylactically sometimes for people that either have to fly or they have to be in a situation where there is lots of people, or they know they are going to be in contact with someone that has infections and colds. It's used for fighting infections. Of course, it helps the thymus gland function, as we just talked about. Therefore, it strengthens the immune system, and it boosts it. It increases the white blood cells, and it reduces, especially in the allergy reactions, that hyperactive immune response. So we can take 2 capsules twice a day. So when you have patients with allergy, this can be used, and it will help reduce those signs and symptoms that they're having.
Okay, Henrietta, that was a great overview for some different immune therapies. Now, you have presented a lot of information tonight, and so bringing it back down into the Dyscratic Constitution, can you just do a general summary of what that is before we move into the protocols?
Yes, of course. Of course, we know the Dyscratic Constitution is the mixed colored eyes, and the remedy to be used is the Thuya, in general 5 to 10 drops twice a day. So what systems does it affect? Well, the immune system, the metabolism, and the skin. And the symptoms that we often see, we go through them once more, just to put it all together here, is weak immunity, it is the autoimmune symptoms, it is the allergies, the food, the environment, it is the dysbiosis, the GI symptoms we see, chemical sensitivities, of course, all our skin rashes, so skin disorders, the growth, as in warts, cysts and polyps. Very commonly, we see gout, and of course, we see many conditions that are chronic. They stay around.
Okay, so with that, then let's move into some protocols. And so within the protocols that are going to be presented tonight, there is a gout protocol, an example of an autoimmune condition, rheumatoid arthritis, an immune strengthening protocol, as long as chronic allergies, and then finally a wart protocol that will actually help with all kinds of different types of warts and getting those warts falling off and resolved within 1 to 2 weeks. So there's some really good clinical tips in that one. And then also, just as a prelude to the very near future, all of these protocols are also from all of the parts for the different constitutions will be put together into a booklet. So we'll be able to have that as a resource for you as well. Okay, so with that said, then let's move into the gout protocol.
The gout protocol, of course, the first one is Arsuya. 10 drops. I like to use my drops twice a day because I find it's easier for compliance, but 3 times is also good. Then we do a little bit less, but for the symptomatic relief, and we need to eliminate the uric acid crystals, of course, a great remedy to use from the Nesman series there is the polygonum. For acute, dose them high, 15 drops in water every hour. These people are in a lot of pain. And then once they stabilize a little bit, then 25. That one I do 3 times a day because they do need it. And the Solidago, we need to drain that uric acid out of the kidneys. So we use 20 drops in water 3 to 5 times a day. We can do it. Of course, alkalizing is very important. The basic tabs that Biomed carries, 3 tablets twice a day. Do take that with warm water on an empty stomach. And another wonderful remedy that Biomed has is called serrapeptase, which reduces swelling and inflammation. So I use that with my gout people. I give them a capsule twice a day, but we have to do that on an empty stomach, so 2 hours before or after a meal.
Now, continuing on the same track with kind of the musculoskeletal system, can you talk about rheumatoid arthritis protocol?
Yes. Again, we need to alkalize, and we start with Thuya, and alkalizing, we can do Plialcala, and we take three taps twice a day with warm water. Again, basic taps. We can do 3 taps twice a day with warm water on an empty stomach. For the inflammation reduction, we can use Clearzyme, which does work very well. 1 capsule 4 times a day. We can use curcumin, boswellia, which works wonders. I love that remedy. Very good for reducing any inflammation. A capsule 3 times a day. We can use Pleoform from the Sanum line, 15 drops in water 2 to 3 times daily. Then we can go to the specific joint support remedy here. Biomed just came out with that wonderful remedy, Aspergillus niger, as this is also called the Aspergillus Constitution. This is a very good remedy to use. You can use 10 drops in water once or twice a day, and you can combine it with Pleoute S, which we only do 5 drops once a day. And then also think about your intestinal support here. The intestine, as we know, contains 60 to 80% of all our immune cells. So the gut is essentially our immune system. So we need an anti-inflammatory diet. So no nightshades, very important there. And we can also use the intestinal kit that repairs and restores the gut and reduces the inflammation.
So moving on, can you talk about this very specialized immune strengthening protocol?
Yes, this is a very good protocol. Again, we start with Arsuya. For organotherapy and immune organ support, we have a few very nice remedies, as in Pleothyme. We can do 1 capsule once a day, or we can use the Immunoplex that we just talked about in that other chart. We can do 2 caps twice a day, or together we can use Pleopin with its a remedy for the spleen. So think about the spleen function as in filtering the blood cells. We can do 10 drops once a day, and then Pleoribosan, if we think about the Peyer's patches, very important. Think about your ulcerative colitis, and your Crohn's in this case, it's a very good remedy. Now, again, we can do the restorative, or we have to do the restorative intestinal diet, and then we have to do the repair and to make sure that we reduce the inflammation. So this is very necessary because the immune system resides in our gut, as we know.
All right, so we've got 2 more protocols. Thanks for hanging in on this one. So Henrietta, can you talk about a chronic allergy protocol?
Yes, as we see so much of allergy patients, and this is an important protocol to remember. Biomed again carries many good remedies for this. So we need to Thuya first, and then for our symptomatic relief, I use Allernest very often, and it's very effective. We can also use Allergies. We can use the Immunoplex, and then of course our allergy patients need C. So C Boost, 2 scoops mixed in a liquid. It's quite a nice drink actually, so patients quite like it. And to break up the inflammation and the excess mucus and congestion, we again use the serapeptase, 1 capsule once a day on an empty stomach. Again, we need alkalis, and depending on where the symptoms are, we can use Basentab, Pleoalkali, or Pleoform. And again, look at that restorative intestinal diet and the intestinal kit for reparation and restoration of the inflammation in the gut. Here we come to the wart protocol. We see many patients with warts, and we see many patients struggling with how to get those away. So some really good pointers here. To reduce that viral load, we can use the mycoimmune. We, of course, use Thuya. We can put the Thuya directly onto the warts. If they do that several times a day, just like you see in the picture, we can do that with topical iodine, but we can also do that topical with the Remedies Thuya. A Q-tip, dip it in there, and apply it multiple times a day. It really does work.
Just to share, the very first time that I tried this, my daughter had a wart, a plantar's wart on her foot, and it was on the side of her big toe, and it was getting painful, and it was growing, and it was cauliflowering, so it was a nice solid wart. And my husband had really wanted me to take her to the doctor so that we could have it frozen and kind of taken off. But from my experience, that's a very long process that doesn't always work really well. And this is how it all happened. I was really thinking, okay, what do I need to do and what can I do? I'm not really sure, but there's got to be some solution out here. That's got to work better. And this is before I knew about Thuya. And so I had a dream, and in my dream, I was told to put iodine on my daughter's wart. And I remember waking up in the morning thinking, okay, well, that was pretty interesting. I dreamt that I was supposed to put iodine on her wart. And iodine's pretty amazing, so maybe. So, I kind of thought about it, and I thought, you know what? I'm going to do it because I'd rather try to figure something out at home than, kind of get it frozen off. So I started putting iodine applications on, and this wart was drinking up the iodine, like it was just absorbing it and like kind of sucking it in. And then after the first day of doing this, I thought to myself, I wonder if iodine actually does work for warts. So I literally started researching it and came up with case after case after case and testimonial of how the iodine would drink up or soak up. So you keep applying as much iodine as possible until it won't absorb it anymore, and then that treatment's done, and then you do it again another time during the day. And within a week, it was completely amazing. This wart fell off, and it was beautiful, clean skin underneath, and I was super surprised. And so I love to share that it's a possibility, and now with Henrietta sharing that, we can also do this with Thuya topically, which is a little bit cleaner and it doesn't stain quite as much. You have to be careful with iodine applications just because you can get things stained. And so that part, I really hope that you've got some patients with warts in your life or family members so that you can go out and immediately start helping people right away with getting these warts cleared up and not spreading, to future people as well. Okay, so with that, Henrietta, thank you for sharing about the warts and the topical thuya, because that's a really great clinical pearl. Okay, so then that brings us to a couple more slides here. And so for those of you that have been on the journey from the very beginning with constitutional medicine, and then constitutional medicine part 1 with the lymphatic constitution, part 2 with the hematogenic constitution, and then today part 3 with the Dyscratic Constitution, it would be great, Henrietta, if you could just do a summary of the 3 constitutions to bring it all together, and then we'll start talking about a few exciting things that are coming up in the future.
Yes, well, let's talk about those people with blue eyes, or lymphatics. Okay, so the remedy, of course, we know is Lymphodrop, a remedy that's been around for a long time. It's one of my favorite remedies because it works like a charm. Now, the affected body system, think about the immune system, and this is where it overlaps the Dyscratic, because the skin and the immune system come into play in the lymphatic constitution as well, and the mucous membrane, but also the nervous system. So think about your itises, because we have all these frequent infections, sinusitis, bronchitis, pharyngitis, laryngitis, cystitis, bladder infections, and kidney infections. We often see, of course, the lymph is congested, so we get edema, and again, we get allergic reactions. Then we move on to our brown-eyed people, the hematogenic, which the base remedy is taraxacum. We do that 5 to 10 drops twice a day. And of course, we think about the body systems affected, the liver, the digestion, the circulation, think about portal vein congestion. So these people have slow metabolism. We'll see conditions like gastritis and IBS, fatty liver and gallstones, poor bile flow, lots of sludge often in the gallbladder, poor circulation. We will find varicose veins, and we will have issue with blood clot formation. Then, of course, what we are talking about today is the mixed colored eye, the Dyscratic Constitution, where we use the thuya, 5 to 10 drops twice a day, which is, of course, the metabolism, again, the skin and the immune system. And as I said before, you can see that this constitution is almost a combination of the lymph and the hematogenic, because it has all these aspects in there. So these poor people, they have weak immunity, autoimmune issues, again, the allergies, the dysbiosis, chemical sensitivity, the skin disorders, the warts, the cysts, the polyps, very often gout, and often these conditions are chronic.
That was a great overview. Thank you. And so now, just to bring it all together, and that you've done the overview, that we've got constitutional medicine with the different constitutional types. So Henrietta, please tell us, what is next?
Well, there is a way more exciting things to come, because what we're going to talk about after the constitution is called the disposition. And the disposition basically is, it represents the sensitivity and the susceptibility to illness. So it's preclinical phases that we can see. And this again is structures within the eye. And the fun thing is, it does reveal our personality traits. So I'll mention the 4, and those personality traits basically line up with the personality types that some of you might have learned with the psychosomatics and the Rubimet. So the first one is called the neurosensitive disposition, which equals the depressive personality type. Then we have the glandular or the mesenchymal, which represents the OCD type. Then we have the vegetative spastic with cramp rings, which is then the schizoid, and the vegetative without cramp rings is the hysteric. So it's going to be fun to analyze those eyes because you will recognize yourself in it, first of all. And of course, when you see your patient, you know what type of personality type your patient is. And that it's always very interesting to discuss that with them because you'll get reactions like, well, how do you know this? But because it is visible. The eyes are literally the windows to our soul. That is for sure a true saying. We're also going to talk about the diatheses, and those are the people with the miasms, the set patterns and structure. There is many of those. We're going to talk about iridology, which is more in-depth training. And the beauty of that is Heather and I are going to do an online course, which will be available in the late summer. And as Heather said previously, you will also get a protocol booklet of all the protocols that we have been discussing.
That sounds like lots of great things to look forward to, all coming throughout and later this summer. All right, and so now we've at the end of our presentation. I would like to invite everyone, if you've got any questions, please type them into the chat room or into the Q&A section, and Henrietta will gladly be able to answer them for you. And with that, we do have one question currently, and this question came up from Kathy. Henrietta, while you were talking about the overview of the 3 different constitutional types, and so she asks, do you use the remedies at the same time and introduce everything right away?
The remedies are used as soon as your patient come in. For the first 6 weeks, they go right away on the base remedy. And sometimes they stay on those remedies for a long time, depending on how they are healing. And can we use all of the remedies at the same time? If necessary, we can, but often we just use the lymphodrop for the lymphatic, the taraxacum for the hematogenic, and then the suya for the dyscratic. But you'll see in the Dyscratic Constitution, you will have to use often with a skin disorder, suya and lymphodrop, and yes, they are beautiful together, and you can add the taraxacum in there as well for the GI conditions. No issues at all.
So I think, Henrietta, you must have been really clear and concise. There's not that many questions coming in, which is always meaning a very great presentation. Okay, so we have another few that have just come through here. So let me just see. And from Faith, she asks, I have a patient who is being treated for blood cancer with chemo. She has a low white blood cell count. I was wondering if the Immunoplex would be the best remedy at this point.
I would go to your mycoimmune. I think I would prefer that. You can put them on the suya and then put the mycoimmune in there. I think that would be a better choice.
I think I would agree as well. With the mycoimmune having the thymus glandular in there, sometimes it's not always the first one to reach for. So Faith, maybe consider mycoimmune instead for this specific patient. Okay, she says, thank you. Great. I like that it's real time, even though we can't actually talk to you. Okay, so now from Olivia, how long is someone on a restorative diet for?
That is depending as well. I also do 6 weeks for sure, sometimes up to 3 months, or sometimes I start reintroducing some of the foods after 6 weeks again, but for sure for 6 weeks.
Yep, absolutely, 6 weeks. That is also from the European Biological Medicine kind of recommendations. What the recommendation is, 6 weeks. It takes about that long for the whole gut to turn over as far as brand new cells. And so 6 weeks minimum, sometimes, as Henrietta, as you mentioned, maybe a little bit longer, like up to 3 months, but it all depends on where your patient's at and how quickly they're healing. All right. So I don't see any other questions here, but I do want to read something out loud that I think would be, it's actually really, Jan pulls this all together. I've known Jan for a really, really long time. I've done a lot of courses over the years with Jan in different aspects of medicine and learning different therapies and techniques. And she says this really beautifully, and this, Henrietta, I really want you to hear as well, because this is something that is really kind of important and why you're the perfect person to be presenting this. So Jan says, awesome information, pulling many courses over the years together, looking forward to what is coming up. Finally, all these different aspects presented by one person and in one place. Namaste, Jan. So that's a great way to, yeah, so nice. And I think Jan really does say it nicely that one of the things that if you've been in this journey for a while, learning biological medicine and homotoxicology and taking lots of courses, even iridology, you'll find that there's different information and lots of it crosses over, but sometimes it takes some work to piece it all together. And so, Henrietta, you've done a beautiful job being able to really piece that together, and I'm really glad that it's not just you and I that can actually see that, but that we have other practitioners. Yeah, so that's great. So thank you, Henrietta. We, appreciate so much your knowledge base and being able to share this information, and really looking forward to what the next things are that are going to be presented, and the courses that are coming up, and the booklets, and more information about the dispositions. So from Biomed, and then also for myself personally, I'm very grateful that you're, willing to take all your 25 plus years of knowledge and experience and studying and really bring it all together for everybody. It's really quite outstanding. So thank you very much.
You're very welcome, with much pleasure.
Thank you so much for attending and learning about constitutional medicine and the different constitution types. So with that, thank you everybody, and have a wonderful evening. Take care.